Americans are learning what life is like during a global pandemic. But we've been here before. This isn't our country's first experience with a pandemic. This is especially true for New York City, where almost 200 years ago, a global pandemic changed the way the city fought disease. Forever.
This country has a very complicated understanding of disease that's rooted in our very unique history.
This is David Rosner. He teaches at Columbia University. His research focuses on the intersection between public health and social history, basically how American society reacts to disease.
Well, from the very beginning, we've had a very ambiguous experience with illness, and that's often been split between seeing disease as something that we as a society or community have to deal with communally, and also disease as basically a reflection of individual fault or individual characters or individual blame.
According to Rosner, for the earliest American settlers, disease was a fact of life, but epidemics were rare. Instead, illness was viewed as a personal problem, and often a moral failing.
So in some sense, from very early in our history, we see disease as kind of a reflection of God's unhappiness with us, with our personal failings, of our personal characteristics that made us vulnerable. Most of the early settlers, Europeans, lived long periods of time, long lives. Disease and death had to be explained as kind of exceptional.
But this didn't last. American society changed. It got bigger and more complex.
So at the end of the 18th century, the world is changing very dramatically. These communities are growing, boats going up and down the coast, trails going inland. People are coming from the countryside into the cities.
America began to build the environments that would eventually kill us. So, flash forward to 1832. New York City has around 250,000 people. Many of them are poor immigrants living in horrible slums downtown. And then the disease cholera arrives from across the Atlantic.
We now know that cholera is a disease of impure water, so it's a very much of a communicable disease, but it's a disease rooted in kind of the modern crowding of cities, the lack of water supply, the lack of adequate sewage, and all sorts of social changes that have occurred in urban housing.
Cholera ravaged parts of the city, killing around 3,500 people.
It's a very interesting moment when you see these older notions of disease, these older notions of what it represents in terms of morality, being merged with kind of anti-immigrant, anti-foreign, nativist sentiment. Somehow these foreigners were the problem, not necessarily the victims, because they were dying in larger numbers because they were poorer, right? But they were the problem. Not the victims of the illness, but the cause.
That moral frame for disease persisted. In many ways, it still does. Immigrants and the poor have always been disproportionately blamed for disease outbreaks. And so it was with subsequent epidemics. Cholera came back in 1849 and again in 1854. Cholera was followed by smallpox and typhus fever. But instead of only focusing on moral scapegoating, the city also established a permanent Department of Health, organized regular street cleaning, brought in fresh water from upstate, and built a network of hospitals. Immigrants and the poor were still blamed for spreading disease.
They sometimes have these cartoons that show Jews and Italians and Irish as basically disease carriers.
But now, despite that misplaced blame, New York's improved health infrastructure also meant the city was better prepared for the next pandemic. With the arrival of the Spanish flu in 1918, that infrastructure was put to the test. During that deadly pandemic, the city responded by staggering business hours. Gyms and armories were converted to house the sick, and a public health campaign encouraged people to cover their mouths when coughing or sneezing. In the end, 30,000 people out of 5.6 million died, a rate of 4.7 deaths per 1,000 people. That rate was considered low, and public health officials credited the previous 20 years of preparation for New York avoiding far more deaths.
New York has this extraordinary history of communities that have built institutions to protect it, and we began to improve. I mean, New York City's health status improved. There are dips and declines and increasing, but in comparison to most other urban areas in the country, we have an incredible infrastructure that still doesn't exist anywhere else.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.